Hello everyone. I am Dr. Omang Agrawal, urologist working at Fortis Hospital, Noida, and also I am the director of my clinic, Ram Kishori Urology and Gynecology Clinic at Greater Noida West. Today we are here to discuss very common problem that occurs in elderly people, that is the enlargement of prostate, also called as benign prostatic hyperplasia. So let's discuss a few questions regarding BPH, treatment options, and what is BPH.
Who all are at a greater risk of developing benign prostatic hyperplasia.
BPH, also known as benign prostatic hyperplasia, is a benign condition, like a non cancerous condition that occurs due to enlargement of prostate, which occurs as we age. As our prostate enlarges, it starts obstructing the urinary flow and we start developing the symptoms of BPH. So, this problem mostly occurs in elderly men who are in the age of 50s and above.
What are the various tests which can help diagnose benign prostatic hyperplasia?
Whenever a person comes urinary tract symptoms like urgency, patient is not able to hold urine for a long time, poor urinary flow, we usually see the patients and examine them physically, take a thorough history, and we do a digital rectal examination to assess the size of prostate. This digital rectal examination also helps us in excluding a few malignant conditions of prostate like prostate cancer. Also, it gives us an idea about the grade of enlargement of the prostate. Tests that we usually do are uroflowmetry, in which we test the flow of urine. How much is the flow of urine? And next test is post-void residual. How much urine is still left behind the in the bladder after a person finishes urination. Third test that we do is a serum PSA test to rule out any malignancy, overt malignancy that can be there in the prostate. Also, we do a urine routine examination, microscopic examination, and urinary culture to diagnose if this obstruction in urinary flow is causing any problem in the urine like presence of pus cells or infection. And after doing all these tests and assessing the size of the prostate on ultrasound, that is the USG KUB, we decide the further treatment of the patient.
Is there any association of benign prostatic hyperplasia and prostate cancer?
There is no level 1 evidence regarding the association of benign prostatic hyperplasia and prostate cancer. Both the conditions are different. Benign prostatic hyperplasia is a non cancerous condition and occurs due to the normal enlargement of the prostate that occurs with aging. And it is not related to prostate cancer at all. Prostate cancer, on the other hand, which also occurs in elderly people, can occur without any cause and it is linked to other risk factors like smoking, obesity, and but there is no association of prostate cancer with BPH.
What are the treatment options available for patients with benign prostatic hyperplasia?
With the advancement of in urology, there are currently many treatment options available for the patients with BPH. The gold standard for the management of prostatic enlargement, that is BPH, is still the old one, that is TURP. Other options are holmium laser enucleation of prostate, thulium laser enucleation of prostate. In these operations, we remove the prostate using the lasers, holmium or thulium lasers. The benefit of doing the prostate surgery with laser is that there is least blood loss and there is lesser risk of absorption of extra fluid that can create problems in the old age. Third, there are other minimally invasive surgical techniques also now available for the patients who are at higher risk of surgery, for such as radium therapy, in which we instill the injections of heated water vapor, steam injections inside the prostate, which causes the prostate size to shrink as the prostatic tissue sloughs off due to coagulative necrosis. Second option, minimally invasive option that is quite popular these days, is prostatic urethral lift. In this operation, what we do is that we apply clips in the prostate that widens the pathway of urine by compressing the prostatic lobes far away from the bladder neck, and hence the bladder neck opens freely and patient is able to pass urine. The benefit of doing these operations are that these are daycare procedures and are not associated with any risk of bleeding. Also, the patient is discharged the same day, so they are more beneficial in the patients who are on anticoagulant, antiplatelet drugs, who can't undergo the surgery under anesthesia due to various other risk factors like heart disease or others. Moving on further, there are few other devices also available these days like eye tind that is done for the patients who have a very small prostate and with high bladder neck. This has the benefit of preserving the retrograde ejaculation that occurs with these surgeries of prostate. So these are the treatment options currently available for patients with BPH. Thank you.